What is coronavirus? We all know that viral attacks are one of the most serious threats to humanity, and recently, some countries, most notably China and places in the Middle East, have been exposed to the outbreak of coronavirus, which has led to serious diseases and syndromes. But how did this virus originate and what is the cause of its spread? Coronavirus. It is in fact one of the most severe types of viruses targeting the respiratory system, and is the main cause of many serious diseases such as acute lung syndrome and the Middle East syndrome that have emerged over the past few years. Coronavirus infection was transmitted from humans through animals, and then between humans themselves. Studies have shown that bats are the original home for the emergence of the virus, and that it has been transmitted to mammals for a long time. Some reports dating back to 2012 indicate the presence of infections caused by this virus in many countries in the Middle East, including Saudi Arabia, Qatar, Bahrain and the United Arab Emirates, and it is reported that more than 80% of these infections were in the Kingdom of Saudi Arabia, and research has shown that the injury was a result of the direct interaction of citizens in those areas with the affected camels and their eating of meat, in addition to interaction with previously infected patients. Causes of coronavirus. As mentioned earlier, the source of the virus is camel, so direct contact with camels, exposure to breathing air directly, and ingestion of one of its products, milk or undercooked meat, carries a high risk of transmission of the virus from it to humans. Reports also indicated that there are cases of transmission of the virus between humans, especially among healthcare workers. The risk of transmission of the virus increases in patients with some of these chronic conditions, chronic diseases such as diabetes, chronic pneumonia and heart disorders. Young and elderly patients. Cases of organ transplantation, whereby patients are subjected to immunosuppressive drugs in order to ensure the body does not reject the new implant. Take immunosuppressants to treat autoimmune diseases. Patients with a weakened immune system, especially cancer patients who undergo radiotherapy and inhibition. Unfortunately, the death rate due to the coronavirus is high, as some statistics indicated that it reached 35% of infected people. Symptoms of coronavirus is classified among influenza-like diseases, with signs of pneumonia, and more precisely its symptoms are similar to acute pneumonia. Here are some of the main symptoms of the disease. 1. Fever. 2. Persistent cough. 3. Shortness of breath and shortness of breath. 4. Shudder. 5. Chest pain. 6. Sore throat. 7. Headache. 8. Diarrhea. Treatment and prevention. Medical research has shown that efforts to develop a fully cure to the virus have not been successful so far, and current treatments are limited to symptomatic treatment and relieving symptoms in the patient. But the efforts of scientists are still ongoing to find it. To prevent the virus, follow the following rules. Use tissue when sneezing or coughing and throw it directly. Avoid touching the eyes, nose, and mouth, especially when cleaning hands is not guaranteed. Wash hands thoroughly with soap and water. Avoid direct interaction with the injured. Clean the tools and areas that are frequently touched.